If you are tired of looking tired and your under eye circles are darkening, are making you look older than you are, this episode is for you. I'm Dr. Mina. Welcome to the Skin Reel. On this week's episode, I am talking to board certified dermatologist Dr. Rebecca Kazin, all about treating the tear trough area. And that is basically the under eye area, which can look hollow, it can look dark, it can look puffy and swollen. And if our eyes are the windows to the soul, you want your eyes to look amazing and look the best they can. And that's where things like tear trough filler plays a role. Dr. Kazin is an expert in all things dermatology, especially cosmetics, and she practices in Bethesda, Maryland at Icon Dermatology. And she's going to be sharing with us what works, what doesn't, and how to make sure you are getting natural, beautiful results with your tear trough treatments and filler and not getting a unnatural, puffy, or bizarre look under there. If your eyes are making you look tired, you definitely want to check out this episode. Dr. Kazin, thanks so much for being here. I'm super excited to talk about specifically tear trough filler because this is an area that I think it has a lot of controversy.
Yes, it definitely does. And it can be done very well or very poorly.
I sort of feel like it's with all filler, like you don't notice the good filler. So then when you see bad filler, you tend to think, oh my gosh, filler's terrible. You can't get good results with it. But it's also because we don't see when it's done well. And I think that's kind of the same thing with tear trough filler, right?
100%. It's such a small area and it's such a delicate area that you really have to pick the right provider.
100%. So we're saying tear trough filler, but what is the tear trough?
Right. So first I'll say everyone has one. It's basically the under eye area. Children have them. It's kind of the area that almost separates your lower eyelid from your cheek, which is an important anatomic landmark, which is why sometimes it looks strange if you overfill it because it looks like your cheeks end at your lower eyelashes. So there should be a little bit of a depression there, hence the name trough. And so it's basically the under eye area. And what we're trying to achieve is what we call a smooth transition, almost like a ski slope from the lower lid eye to the cheek, to like the apple part of the cheek. And so as we get older, lots of things can happen and it can unmask some volume loss there. So it can be more depressed and look darker because of shadowing. Some people get puffiness there. Some people get the double whammy of puffiness and then an indentation.
And darkening.
And darkening, right. And so, it's multifactorial, but what's exciting is we as dermatologists understand more and more what is happening underneath the skin with aging. And so we're trying to be more precise in our treatments to increase how natural the results look.
I think sometimes people just universally will say, they'll call them bags under the eyes, but it's maybe really, it's not bags that's the problem. It's more that there's a shadow or there's discoloration or it's blood vessels or, it could be a lot of different things. And so you're 100% right. Like we need to know specifically what's the issue because it's not a one size fits all filler for everything, right?
Exactly. And I have found personally the best results I get are, unless the person is young, like 20s, 30s, and you might be able to pick one modality, but most of my patients are like Gen X or boomers. So generally I need to combine like an energy-based device, likely with filler, to get a really nice result.
So I'm in my 40s now. I'm like right on the cusp of millennial and X. And this and neck seems to be like top concerns for my friends and my patient, and definitely an area that people are wanting treatment. So speaking specifically about filler and probably hyaluronic acid filler, right? Who is a good candidate for filler in this area?
So technically the best candidate is someone who, when they're examined, there is volume loss because literally filler is basically almost like a gel-like substance that's placed under the skin and fills in lines. It does build some collagen, but basically it fills in lines. And so if the issue is not volume loss, then the filler is not the solution. So I look for volume loss because, like you said, sometimes people notice darkness under their eyes and they come in and say, well, I need filler. But when I examine them, I see that the darkness is caused by something else, and filler will not be the answer. So I think it just is a good diagnosis of volume loss.
What about if someone has pretty prominent outpouching of the fat from the lower eyelid? Are they a candidate for filler?
So those patients, generally, I tell them that it can improve the appearance. I have very good relationship with surgeons, and so I do tell them that they would potentially be a candidate for a lower lid, what we call blepharoplasty, which would take away that extra skin. But many of my patients come to me because they don't want surgery. So they ask if there's anything they can do non surgically. And I do feel that although it's not as impressive a result, you do still get an improvement, maybe like 50% improvement if you fill in under that puffiness. Because again, you're just improving the transition then between the puffiness and the cheek. But I tell them I'm in no way trying to raise up the skin to the level of that puffiness, because that will then make their eyes actually look very small.
And look really, really unnatural. When you get that, your cheek starts at your lash line. I do find, because I actually do the blepharoplasty and the lower blepharoplasty, and even for my patients who do undergo the lower blepharoplasty, sometimes they still need filler in that tear trough area, right? Just to keep everything natural looking, because we do get that flattening as well. So sometimes, again, like you said, it's not a one-time thing. But I agree with you on the adding a little bit of filler right under where they have that outpouching of fat from the eyelid. It's not going to remove the bag, but it just makes that transition smoother. So it's less noticeable, and it does help. But I will say, the tricky thing is not getting filler or more volume into that eyelid skin, right?
Yes, yes. And that really goes down to, technique. And I have just learned over the years to limit the total amount of volume that I place per treatment. I think that that improves the results. Basically, I use one half of a syringe or one half of a cc per side per treatment. And I find that it takes that amount for the skin to integrate it. And then I will then layer it maybe a month later, a few months later. But trying to put more than that can oftentimes, like you said, go into the wrong area or look lumpy bumpy or swollen. So I tell people it'd be like a slow build.
I love that approach too. And it gives people time to adjust to it, to get used to it. And I do find it much more natural results if you can do a little bit along the way instead of rushing to fill, 50 years of volume loss, right, in one session. And you had kind of mentioned some of the complications, I guess, or I should say like side effects that can happen with filler. What are the most common? I mean, I'll start with bruising, and I don't consider that a complication. I actually think that's just almost expected.
You are poking the person with a needle. So, right, there are blood vessels there. Now, I will say for the under eye, I usually use something called a cannula, which I explain to patients is sort of like a blunt tipped needle. And I do feel that the risk of bruising is a little bit less with that. And supposedly it's a little bit safer as far as getting into the wrong place, including blood vessels. So I do use a cannula, and with that, I'm able to only poke the area once per side. So I used to get a lot more bruising when I would use a traditional needle. Now, sometimes I do have to combine and use a cannula and then use a needle for the fine tuning, because cannula sometimes doesn't do as much fine work. And then I do warn patients that a bruise is a possibility. So for that, I try to have them. Certainly, I love when they say, I'm just on a baby aspirin. I'm like, nope, that's actually the worst for bruising, even just a baby aspirin. It is very powerful. That's why it's so good for your heart. I tell patients, if you need it for stroke prevention or heart attack, do not go off of anything. But if it's just for prevention, try to go off of anything that can cause bruising really about a week before. I don't think people realize that they really should, if they're really worried, about a week before, the night before, right? So I give them a whole list. And then I try to tell them to stay off of it for a few days later. And if I do see a bruise and it's pretty noticeable, we do offer a complimentary laser treatment to try to make the bruise go away faster the next day.
Another great reason why not to do this right before a big event, right? Don't do it the day of your prom or your wedding or even really a week before. At least for me, I feel like it takes about a week for the filler to kind of settle in and really look natural.
Oh, yeah. I tell people 2 weeks. Being outside of DC, I don't have any people, walking the red carpet that night. But so I tell people really try to say you'll be photo ready in 2 weeks because, again, it is a gel and it's a very thin skin area. And although most of the settling will be done in a few days to a week, really it can take 2 weeks for everything to settle in. I do the same thing for lip filler. I try to give them that sort of window.
I love a cannula too in this area because I find I get way less bruising. It's not zero. I have seen bruising with the cannula, but I think it's important for people to know bruising can just happen. And if you are on blood thinners, a lot of vitamins people don't realize, like fish oil, ginseng, ginkgo, these can cause bleeding as well. Alcohol, Motrin the night before, things like that can all affect it. So I just think bruising can happen. And the other thing I notice is patients can get a good bit of swelling if you're using the HA filler. So I usually try to warn them, hey, you may wake up tomorrow morning and feel like, oh my gosh, my eyes are extra swollen. Do you see that in your practice?
I used to see it a little bit more because we had less choice with fillers. Now I tell people fillers are like makeup brushes. There's so many choices. And so I feel like I've chosen certain ones that I don't see as much swelling as I used to. But I definitely ask them if they can to sleep propped on two pillows that night and to try to sleep on their back and don't do anything that causes all the blood to rush to their head that day or even the next day if possible, namely exercise or yoga, something like that. But yes, I will still see a little bit of swelling, but not nearly as much as some of the older fillers I used to use.
Yeah, yeah, they make some super, super thin ones too, which I think helps with that lumpy bumpiness that can happen. Can you kind of explain why does that happen? And then also, why does sometimes the filler look blue?
Yes, yeah. So, as I said, the filler is a gel. I tell patients it's almost, you could think of it like a toothpaste gel, but basically it's a clear gel in a tube. And there are different layers of the skin that it can be applied to. And so, oftentimes, what I do is start by applying it to the deepest layer. And so, what's good about that is over top of that layer is muscle and a little bit of a fat pad and a little bit more of a padding so that you don't see really much of those surface irregularities that can be from injecting a gel. And so with that, you can get a pretty nice correction. But sometimes you have to go a little bit more superficial to get some of the finer lines and indentations. And with that, the skin over top of it is just so thin that it can see any irregularities in the gel application. And so generally what I'll do is at the time of treatment, I will take a Q-tip and just sort of roll it over the area to just sort of make sure it feels smooth, that there's no specific bumps. Sometimes if I'm trying to get it really into the corner, I roll the Q-tip up towards the corner to kind of roll it in there because you don't want to poke that close to the middle of the eye. And so I get it so that I don't see or feel any lumps or bumps. Now, I do tell patients generally give it 1 to 2 weeks. And if there's a lump or a bump at that point, because there's a muscle around the eye that's circular, and every time we open and close our eyes, it's kind of contracting and it can sometimes cause filler to bunch up a little. I tell them to give me a call, email me a photo. You can come in and I'll use a Q-tip to press it out. And very rarely, we do have a medicine that we can inject into a bump to dissolve it immediately. But fortunately, I find I don't have to do that very often, but it's a nice little safety insurance policy.
Yeah, absolutely. That's one of the great things about these HA fillers is that you can dissolve them if you need to, but sometimes just a little massage, a little Q-tip, a little pressure can do the trick too. So great. And what about sometimes that you'll get that bluish color?
We call it the Tyndall effect. The effect is why the sky is blue, but it's basically the gel is clear and the way that the light is reflecting off, it interacts with the clear, sort of like the ozone, and it makes it look bluish. I don't know. You have to ask a physics person about that. But anyway, it makes it look blue.
Yeah, it's all like light refraction, right?
Light refraction, right. So the filler is not blue, it didn't turn blue. It's just the way that the light is bouncing off. And so what can sometimes happen is either sometimes filler that's been there for a very long time, because we've learned now that that area can retain filler for years, not months, but years. And sometimes it's almost like a sanctuary for your immune system. For some reason, your immune system just kind of leaves it alone. and it can stay there for years. And then as the product just is sort of broken down by your immune system, it can, I call it like bubble up over the muscle where we didn't place it. And then it can cause that weird light reflection. Now, if that's the case, then all we do is use some of that dissolving medicine. It goes completely away and then replace it under the muscle where it won't look blue. So that can happen. Now, what can also happen is if it is not placed in the correct layer when it's placed, then it is in that above the muscle layer, and then it can also look blue. Or if too much is placed in one sitting, there's almost like no capacity for the area to kind of absorb it, then it can again get into that wrong area and look blue. But the good news is that is totally treatable. Ironically, it is one of the hardest things to talk patients into to dissolve it a little bit because they've almost gotten used to it, even though I tell them that that's not a natural sort of color under the eye and that I could improve that. But people get pretty attached to their filler. But I really do tell them it will look nicer. But yeah, so if you do see that it looks like a blue egg, it's not like veins, so they're not lines. But if you see like a bluish egg, that can be treated. That is not the optimum outcome.
Exactly. And even if you've had it for several months, don't get attached to it. It can be fixed. You kind of touched on this a little bit. I feel like we're hearing a lot about filler migrating, it's staying a lot longer, and it's kind of scaring some people. They're thinking this filler is going to be with them until they die and it's going to move all over their face. What are your thoughts about that in this area around the eye?
I think, like most things on social media, it's very overblown. I mean, I'm sure as you, I've been doing filler now for 2 decades, and I really don't see this concern at all. Now, on a very micro scale, like I said, in the past, when I would maybe try to do more than a half cc per side, I felt like maybe it doesn't migrate. Like it's not going to go from here to here, but maybe I would call it more like spills over into an area where we didn't necessarily want it. And so I have just sort of learned that if I go a little bit lower and slower, it doesn't spill out into that area. So I don't necessarily consider that migration. As far as lasting for a while, we do feel like the under eyes specifically, it can last. It doesn't happen in everyone, but it can last. The good thing is I tell patients with hyaluronic acid filler, it is like a sugar molecule that's already found naturally in our skin. It, absorbs water, builds collagen. And so it is safe to be in there. A lot of our moisturizers use hyaluronic acid. So we actually like HAs in the skin. So it's not doing anything. It can't turn into anything. And so if you see it on some sort of imaging, it won't mask anything. It won't like make it so that they can't make some other diagnosis. So I wouldn't worry, but it's something that, again, over 20 years, I've not really had a patient have an issue.
I'm with you there. I will say if it is going to like migrate, sometimes it does get squished to a nearby area, right? Because that skin is so thin. And this muscle around our eye is pretty active and can be dynamic. So I think there sometimes I do see maybe it moves a little or it moves in an area that wasn't placed. But yeah, I do think this fear that it's going to, spread to your lips or to your temple is unrealistic and not something to be worried about.
Exactly. I think right. And I tell people, because sometimes with the lip, even it happened more in the past when I would go more along the border, but it can actually, same sort of circular muscle, it can go up into the white part of the lip. And again, I wouldn't call that migration because that seems like it's going very far. I would call it spilling over, spread, right? Local spread.
And I also find, when I'm seeing those videos on TikTok or whatever, someone's saying, look at my filler, how it migrated. They had huge amount of filler.
Exactly. That's what I say. I'm like, that's usually with huge amounts. They're almost placing it like an implant. And so it's just this big glob under there. And so, yeah, that could potentially move. But again, if you're doing best practices, that's not going to happen. So it does come down to the provider.
I'm with you on that. So I'm glad we're on the same page. Can you walk us through like a patient comes to see you for filler? Like what can they expect? What's the actual process like? How long does it take? Can you drive yourself? Like what's that like?
Right. So when they come in for consultation first, they'll tell me maybe like I look tired or specifically, I don't like my under eyes. And so, of course, like I said, I'll examine them. You really need to put on terrible lighting. So, I put on like that overhead lighting, like in the bathroom, because that accentuates all the shadows. And then I also look for the side and and to really assess is there volume loss. And then I actually touch the skin to see if I can move some volume there. Does it kind of help fix the problem? So I go through all of that. Then I show them in the mirror, what I'm talking about, the areas that I'm talking about. And then I tell them about the procedure. Well, first, we would obviously get consent and then we would take photographs. I do feel like photographs are very important to just make sure that I did a good job and you get to see them. And so photos are a big deal. We don't share them, obviously, with anyone unless you approve. So we use topical numbing gel, pretty strong numbing gel. Fortunately, that area is pretty thin skin, so it numbs very easily. But topical numbing gel. Now, it does sometimes work its way up into the eye. I've certainly gotten into my eye. I've tried every procedure I do on myself. So I've definitely gotten numbing gel in my eye. It does not harm you at all, but it does sting a little. So I try to leave a little bit of a margin. But especially when I'm using a cannula, I'm only really numbing lower down, so it doesn't migrate up into the eye. But anyway, we put numbing gel on for generally about 10 to 20 minutes. Then, I come back in, I take the gel off, I clean their skin, and then basically, the treatment itself involves like a little poke with the cannula, and then I am sort of fanning the cannula under the eye very slowly. It's not at all like Botox where you just sort of poke and put it in like water. It really is like a live sculpture. So you get immediate feedback about how it's going. Are you in the right plane? Is that plane, doing what it needs to do? Which is why I love fillers so much because you can adjust on the go if something is not, the skin isn't lifting as you thought. And so we do look for that improvement. And then after I do this part, I will either feel with my finger or Q-tip to make sure it looks smooth and feels smooth. I do tell the patient that the filler is mixed with lidocaine. And so sometimes that area can get a little numb and it can feel weird when they blink. So that first happened to my husband. So I remember it now when I did his, and I tell them won't affect your vision because they start to get a little nervous, obviously. And then once I'm done that area, I ask them if they want to see it before I do the other side. Some say yes, some say no. And then I leave the numbing on the other side until I go to that side. So then I take the numbing off and I do the exact same thing. And then I have them sit up a little bit and I look at them and I see, how symmetric it is. No one is 100% symmetrical, but I try to do as much as I can. And then I show them, and then I'll give them the aftercare instructions, which basically is to try not to put makeup on that night. They could put makeup on the next day. And I talk about avoiding exercise like we talked about and anything that can cause bruising. But pretty much that's it. So 100% they can drive themselves. I don't think anyone would be none the wiser. They go to the grocery store, they can do whatever they want. Most people would probably not notice anything. But if they want to sort of take it easy after that, they definitely can. But overall, people are understandably nervous because it's near their eye. But I feel like they take a deep exhale after and they're like, that really was not as bad as I worried it was. And then when they come back for the next one, they're not nearly as worried.
I think it's just a sensitive area. And especially if it's your first time, it can make you a little bit anxious. But yeah, especially with the cannula, you have that one little poke that you could throw on some sunglasses. And even without sunglasses, people in general wouldn't really know you had anything done. So
Yeah, that's what I love about it. And it does make an impact. I mean, it really does brighten up the area and it just makes people look more awake.
exactly. Yeah, I feel like a lot of people want it not because they're trying to look younger or look 20, right? They're just tired of people saying, oh, are you upset or what's wrong or you seem angry or tired. Like they don't like hearing that when they feel fine or maybe they feel great.
I know. I think we've all had that happen to us. And so much of filler is about sort of shades and contours and light reflex. And I think that what people don't realize is certain dermatologists have like a skillful or artful eye. And, there is an art to it too, because you kind of look to symmetries and contours. And so I think why it helps under there so much is because it does change the light reflection. Whereas when there's hollowing, the light kind of gets lost in there and the shadow forms. But when you improve that even 50% and you get more light reflection, it's really a nice result.
It can really be changing of their whole appearance. And you don't need a ton, right? And in fact, you shouldn't use a ton because that's when it looks unnatural and doesn't look right.
Exactly. So the other thing I was going to say is just as far as correction. Some people also need a little bit in this part of their cheek, the front part, like the apple part of the cheek, the part directly under the lower lid, because what's happening is there's volume loss there too. So, in order to really get a nice result, I sometimes add some volume to that front part of the cheek as well. In that case, I will do more than a half per side, but generally it's a nice sort of add on to that area.
Yeah, I find that universal people get that flattening on either side of the nose, that central face, and a little filler there can be helpful. I've had filler for sure. I've never had it in my tear trough. That's not where I get it, but I have needed it in like the apples of my cheek. So people are different, right? Like someone might have really full cheeks and not need it there. So
Exactly. I mean, I tell people age sort of somewhat similarly, but because of what you're sort of given genetically, it can look different. And so, we all are having bone resorption and laxity and stuff like that. But if you already had a deep tear trough, then when that starts to happen, it just gets more noticeable. But if you didn't have that before, then it's not. So it's partly what you started with, which can affect how you're aging.
yeah, absolutely. You had mentioned before that you use different modalities, maybe energy based devices. What are some of your favorite things to pair with tear trough filler or to kind of help this area look the best?
So it's evolved over time, and I really do try to make an actual diagnosis of what is going on in the under eye because it can be so many different things. So, kind of the easiest is if it's blood vessels, because we can see if there's broken capillaries, or sometimes people will get those blue veins, especially when they get mad or stressed. Those can be really lessened with what we call a vascular laser. And you have to safely do it. You have to put goggles on, eye protection, and all of that. And it can take a series of 1 to 3 treatments. But you can really get some nice lightening if some of that bluish, purplish, reddish hue is from blood vessels. So I do look at that. And then I look at whether the skin is sort of what I call crepey, like tissue papery. And for that, I generally do, there's so many options now, but I'll do either microneedling, or I'll do radiofrequency microneedling, or I'll do some sort of fractionated ablative or non ablative laser. And depending on which laser will depend on your healing time. And also, it depends on your skin color. If you have a little bit more pigment in your skin or not, we can choose. But I go over all those options. And then the other thing that I've started doing, maybe over the past 2 years, is a deep heated treatment. Like we use an ultrasound device that I have found works very well to, especially in this mid face, to improve the junction between the lower lid and the cheek. I tell patients, I try to show them because they don't really know what I mean, but with age, the distance between your lower lash line and the apex of your cheek lengthens, and it makes people look very drawn. And so this laser shrinks that up, and it just makes people look more youthful. And so I found that usually I'll end up doing filler plus either a resurfacing or the tightening. Some people need all three, but I try for time and money purposes to sort of pick two, and then I can get what I consider a better result.
And sometimes I'll even just do some pan volumization with some biostimulants too. I think can help in that area. The temple also lose it. You get some hollowing there, which can sort of accentuate the eyes. And again, this is why seeing someone like a dermatologist who it doesn't just have one modality that they know how to do and can really pick the best one for you and what your issue is.
I agree. I mean, I think that's what really sets us apart from what I call injectors. And I love injectors, but I tell patients I am not your injector. I'm your physician, and I'm here to kind of give you a tailored approach to this concern. And some of these treatments I think is more beneficial than each one separately. But again, I do oftentimes start with filler because it does give the fastest and sort of most impressive result. It's just that sometimes you need something else to really get you all the way there.
Yeah. You fix that maybe hollowing, but you then still have the crepey skin or the sun damaged skin. It still doesn't look its best. So tackling that is also really helpful too. And sometimes I think getting someone to buy into doing a big resurfacing procedure is a little bit harder than, we'll do a little filler under your eyes. So baby steps.
Right. You need to sort of meet them where they are. Depends if they've known me for a while. So There's lots of options.
which makes it so much fun. Dr. Kazin, this has been a lot of fun. I've learned a ton. I'd love it if you could just share your top 3 tips for someone who is maybe considering under eye filler.
So, first, I would pick your provider carefully. I know that's very hard because I've been on the other side and trying to pick a provider for myself or friends or family. But really, when you do that, you should perhaps either go with a direct recommendation of somebody that has had a treatment with that person, or you could also meet with a couple different people and see where you feel the most comfortable, because you really do need to feel comfortable with that person. That's the first thing. And then make sure, obviously, that you're diagnosed properly, that you do have the issue that will be improved with filler. I've seen that sometimes happen with Botox, where patients will come from other offices and say Botox didn't work for them. And when I really drill down, it's because what their problem is was not going to be fixed with Botox. So you have to make sure that your problem fits with the solution. And then it's just making sure that you have appropriate expectations about the treatment and a reasonable expectation about that everyone's a little bit asymmetrical and how the process will go. So I think it's just being informed. I think that that's just really important.
I feel like that's great advice for so many things, right? But also for your skin. And especially because this is cosmetic, you don't have to do it, right? And so you want to make sure that you're going to get good results and you're not wasting your time and money.
Exactly. I mean, this is not the area to try to save a few pennies. That being said, you don't want to be taken to the cleaners. But again, I feel like if you find a provider who you can trust, you'll know that they're doing right by you.
Yeah. And I love the advice. If you can, find someone who's had the treatment and do you like the results? Because I find, before and after pictures, sometimes the lighting's different, there's a filter or whatever. So I think if you can actually see in person someone who's had it done and you like the results, I always think that's the best way to judge.
That is the best. And then I love getting those referrals because they've seen the person. They also know that I will take good care of them. So those do mean a lot.
Well, Dr. Kazin, I know people are going to want to find where you are and follow you. What's the best place for people to do that?
So our website is called Icon Dermatology and Aesthetics. I think it's actually just icondermatology.com. But anyway, if you look up ICON Dermatology and Aesthetics, you'll find us. And then I do have a very small Instagram. I try to put stuff on there. It's just Rebecca Kazin, MD. If anyone has any questions, they could message me on there.
Okay, awesome. Well, hopefully you'll get a slew of followers.
Thank you so much.
Yeah, I'll include all that in the show notes. Yeah, if you're in the Bethesda area, definitely go check out Dr. Kazin. And I really appreciate you being here, and we'll see everyone next week.